Have you ever wondered how a simple blood test can reveal so much about your health? Welcome to Clinical Chemistry, the lab science that deciphers body chemistry. Clinical chemistry analyzes chemicals in body fluids like serum, plasma, and urine to assess organ function, nutrition, and metabolic states in a quantitative, standardized way. These tiny chemical clues help doctors diagnose disease, monitor treatment effectiveness, and predict future health risks before symptoms become obvious. Samples come from blood and urine. Labs examine serum and plasma for enzymes, electrolytes, hormones, and metabolites to build a biochemical picture. Small changes in concentration can signal inflammation, organ damage, or metabolic imbalance, making precise measurement and quality control essential for reliable results. In this video, we'll explore lab workflows, key tests like blood glucose, and how results guide clinical decisions and patient care. Modern chemistry analyzers automate most testing, running hundreds of samples per hour with robotic handling, optical detection, and integrated data systems. Assays combine reagents and samples. Reactions produce measurable signals like color change or electrical current proportional to analyte concentration. Calibration against standards and regular quality controls ensure accuracy. Without these checks, results could mislead clinical decisions. Results flow into laboratory information systems, where algorithms flag abnormal values and prioritize urgent samples for clinician review. Laboratory scientists validate data, troubleshoot instruments, and collaborate with clinicians to contextualize findings for each patient's history. Reference ranges depend on method, population, and units, so labs report values alongside intervals to help clinicians interpret results correctly. Proper sample collection starts with correct tube selection, labeled patient information, and minimizing hemolysis that can alter many analytes. Centrifugation separates serum or plasma from cells. Prompt processing preserves stability for accurate measurement of sensitive markers. Assay steps are simple in principle. Mix, react, detect, and calculate concentration using calibrated algorithms. Controls run with patient samples to confirm assay performance. Out-of-range controls trigger investigation and repeat testing before releasing results. Electronic flags and comments help clinicians understand limitations such as hemolysis, lipemia, or delayed processing affecting values. Turnaround time varies by test urgency. Emergency panels are expedited while routine panels follow scheduled batch processes. Blood glucose is a central parameter because glucose fuels every cell. Its measurement is fundamental to metabolic assessment. The body regulates glucose with hormones. Insulin lowers blood sugar while glucagon raises it, keeping levels within a tight, healthy range. Normal blood glucose averages about 100 milligrams per deciliter. Fasting values typically range from 70 to 100 milligram per deciliter. Laboratories measure glucose with enzymatic methods like glucose oxidase or hexokinase, producing precise, standardized results for clinical use. Point-of-care meters provide rapid bedside glucose readings but may differ slightly from central lab results and require quality checks. High glucose may indicate diabetes or acute stress. Low glucose can cause dizziness, confusion, and requires prompt clinical response. Clinicians use chemistry panels to diagnose diabetes, monitor medications, assess organ function, and guide nutrition and therapy decisions. In emergency care, rapid chemistry results detect life-threatening issues like severe hypoglycemia or diabetic ketoacidosis, enabling immediate treatment. Pre-analytical factors matter. Fasting state, sample timing, and handling can change values significantly and must be communicated to the lab. Laboratories are evolving with automation, digital dashboards, and personalized reference ranges to deliver faster, more tailored patient results. Clinical chemistry translates chemical measurements into clinical insight, helping clinicians detect disease earlier and monitor treatment more precisely. Regular testing, careful lab processes, and informed interpretation keep blood glucose and other biochemical markers useful tools in patient care. Thank you for watching, and don't forget to like this video and subscribe to this channel for regular videos on biochemistry, microbiology, and lab techniques.